Welcome to Healthy Canadians, your place for nuanced conversation and expert insights on health topics that matter to us all. We have practical information and resources for you and your family to stay healthy. I'm your host, Megan Beahen. What if I told you that there's an invisible, odorless gas in your home that is also the leading cause of lung cancer for people who don't smoke in Canada? A bit scary, right? Well, it's true, and it's called radon. But the good news is there are relatively straightforward solutions to mitigate the risks. We'll dig into all of that in a moment, but first a word from, well, us. Healthy Canadians is brought to you by Health Canada and the Public Health Agency of Canada. We aim to give you information and perspectives about the health topics that matter to all of us living in Canada. What we discuss won't always reflect the official positions or policies of the Government of Canada, but that's okay. These are conversations, not news releases. Okay, let's talk about radon. Today I sat down with Kelley Bush, Manager of Radon Outreach and Stakeholder Engagement with Health Canada. Hello, welcome Kelley.
Thank you.
Thank you for coming on the show today.
I'm super excited to be here.
Awesome. So today we're talking about radon, and we were chatting a little bit before about people in Canada and their awareness for radon has actually increased quite a bit in the last few years, and the risk of lung cancer from radon. And I'm thinking right away to myself, like, lung cancer, not really on my radar. I don't smoke, so it's not something I think about personally. So maybe you can tell us a little bit about the risk of radon. What is the risk? What does it pose?
Well, lung cancer. We estimate that about a little over 3,000 Canadians a year will die from radon-induced lung cancer. That's more than 8 people a day.
Whoa.
Yeah, so it's pretty significant. And it's the number one cause of lung cancer if you don't smoke.
Wow.
And the number 2 cause after smoking, obviously. So a significant contributor to your risk of lung cancer. And it's still something that not enough people know about. And so often what I try and do is compare it to better known risks. So the risk from long-term exposure to radon from a death perspective is equivalent to all accidental deaths. So that would be drownings, car accidents, fires, poisonings. So if you wear a seatbelt when you get in your car, if you change the batteries in your smoke detector every year, if you put a life jacket on your children when you go on a boat, you should also be testing your home to know if you have high levels of radon.
Wow. That's pretty shocking.
Yeah.
Do people that you talk to have that reaction as well? They're pretty shocked to hear that?
Yeah, they do. They do. And then it either leads to looking into more information to validate and determine their own beliefs, or they choose to say, no, that can't be true. It's not an issue for me. And then it takes hearing the message a couple more times before they actually do something about it.
Okay, cool.
Yeah.
Well, we're going to talk more about motivation in a little bit, but maybe we could just start with the basics. What is radon and why is it in our homes?
Right. Good question. So radon is a radioactive gas. It comes from the breakdown of uranium in the ground. So we have natural uranium in our Earth's crust everywhere. So while uranium breaks down, it breaks down into a number of different things. Finally, it becomes lead. But in that process, one of the decay products is radon gas. And as a gas, it can move from the ground to the outside where it gets diluted, or it finds its way into homes and buildings that are in contact with the ground. So it's a risk when it gets into our homes because it can accumulate to high levels.
Wow. So is it in all of our homes?
Yes,
Always.
absolutely.
Some level.
Yeah, every building in contact with the ground, every home in contact with the ground will have some levels of radon in it. In fact, with the type of devices that we have at the Radiation Protection Bureau, we can measure radon in outdoor air as well, although it's at very low levels.
Okay.
The only time you wouldn't have radon in your home is if you live in a houseboat or a treehouse.
Okay, that's good to know. So really this information is for pretty much everybody.
Absolutely.
Right?
Yeah.
Okay, so I know people are going to hear this and they're going to want to know right away, Is there something I can do? What do I do? We're going to talk about that more in detail, but maybe you could give the good news side to this, that there is a solution, right? There's something people can do.
Yeah, it's so important to know that, because that's often a barrier. That's what we found to people taking action, because they hear this information about lung cancer and radioactive gas, and they're like, well, there's nothing I can do. I don't want to know about it. I'm not going to test. But you can do something about it. You can test, first of all, and it's really easy and inexpensive to find out if you have high levels in your home. And if they are high, they can be fixed easily again.
Okay. That's awesome to hear. And if people wanted to get more information right now about testing and mitigation, where would they go?
Yeah, right. So you would go to canada.ca/radon.
So maybe we could talk a little bit about the history of radon, because it's pretty interesting.
Yeah.
Maybe you could tell us a little bit about how it was found and when.
Yeah. So radon gas was first discovered in like the 1800s, at a time when there was a lot of research going on about sort of radioactive materials like uranium and plutonium. And there's a number of researchers and countries that claim to be the first to have found
Is
radon.
Canada one of them?
Yes, absolutely. So 2 researchers out of McGill University, in fact. And this was at a time when they were just doing research and they had no idea that radioactive material was harmful to health. They had discovered it in the minerals in the ground, and were doing that research and saw as a part of that how a gas was emanating from uranium.
Wow.
Yeah.
Very cool.
And then in the 1900s, there was a gentleman named Stanley Watrous, and he lived in Pennsylvania in the U.S. and had started a new job at a nuclear facility. And one day he walked into the facility and set off the radiation detectors. They have them there as a security precaution in case you get exposure while you're working and when you leave. But the problem was the facility wasn't operational yet, and there was no radioactive material in the building. So the question was, how was he setting off these monitors? And after an investigation, what they found was his home had extremely high levels of radon.
Whoa.
So high that it was decaying really fast and leaving particles on his clothing. And that's what set off the detectors. Now, those levels were higher than you would normally find in a home, but it was the first incident of finding radon in a home. Because prior to that, and it's because I skipped over it a little bit, in the earlier 1900s, there was research related to exposure to radon in uranium mines, because they started seeing that there was higher levels of lung cancer for uranium miners. And then this incident happened with Stanley Watrous, and we realized that there was also a risk from radon levels in homes.
Okay, so that's how we discovered that it could actually be in your home. Not could, it is in your home, and an elevated risk is when it starts to be, when there's an elevated level of radon, it becomes a big problem.
Right.
That was a really big problem, though.
Yes, and that's how we discovered in North America. There's stories, of course, because this research is going on globally. So there's stories of how it was discovered in Europe and Asia, et cetera. But that's sort of the big story of the background of radon in North America and Canada.
That's pretty cool.
Yeah.
I want to come back to the risks a little bit in terms of health risks. And I'm curious about, how does radon actually interact with our bodies? How does it cause problems? How does it pose that risk of lung cancer?
Yeah, such an important question. Because often when we start talking to people about radon and the health impact, which is lung cancer, there's these questions about asthma and respiratory effects and stuff, and there's really none of that. Unfortunately, there's no symptoms from radon exposure. What happens is, because radon is a radioactive gas, it's an alpha radiation, and when it's released into the air, the radioactive particles attach to dust and other things in the air, and we breathe that in, and it gets lodged into our very sensitive lung tissue. And again, that radiation continues to decay and release energy. And that released energy causes damage to the lung tissue and the DNA. And over time, that leads to lung cancer.
Okay. So this is not if I had a nagging cough for weeks or months.
Well, so that long term, that is a symptom
Okay.
of lung
Of lung cancer,
of
but not
lung
a
can-
symptom of having
No.
radon. This
No.
isn't like a mold or an asbestos situation.
No, where it's causing some irritation. It doesn't do
Right.
any of that. It's truly the effect
Okay.
is damage to the lung tissue and to the DNA.
Okay.
Yeah.
I bet you get a lot of calls or questions from people about that. People who think that they might have radon because they have asthma.
Or COPD or other things like
Okay.
that. No, and we really don't want to deter them from finding the cause of those ailments, because right now the only health risk that's known based on the research that's been done around the world is an increased risk of developing lung cancer.
Wow.
And it's really an issue of prevention because unfortunately lung cancer doesn't get diagnosed till often too late.
Right. So you don't want to wait until you have lung cancer to find out.
No.
And start testing if you have radon.
No, that's why we're making sure Canadians know about this so that they can test and they can reduce their exposure, because it's long-term risk and it's cumulative risk. So if you take action, the sooner you take action, the better, essentially.
Absolutely.
Yeah.
Maybe you could talk to us a little bit about where radon lives in the home. Because when I first heard about radon, I thought, I don't think this is really for me, because, or I don't need to be worried because I live in a condo. It's a new condo. It's a new build. And I live on the first floor. We have a basement, but it's like a sub-basement. So I think I do need to be worried, but maybe you could talk a little bit about where it is.
Yeah. So first I will say I get that question all the time. The radon levels in my area, I haven't heard about it, so it can't be an issue. My neighbor tested and their levels were low. So you're never going to know what the radon level is where you live unless you test. So that's always my answer. Whether your area is known to have lower or high levels, you can't know what's in your own home unless you test. With regards to where you live in a condo, so we have done some research to look at the risk of radon in higher levels, because radon comes from the ground. So naturally, the highest levels of radon in a home are going to be found in the lower levels of the home, but it can move. We have ventilation systems that circulate air, et cetera, so we can find higher levels of radon in the first floor or the second floor of a home. But the research that we did, what we saw was typically we did not find high levels above the second story. But again, you can test and find out pretty easily, so we would always recommend testing.
What if I have a basement, but I never hang out in the basement?
Yeah, we get that question. So there's this concept of you don't have a basement, because there are homes that are built what they refer to slab on grade, right?
Right.
So they may have a crawl space or no basement at all. You still have to test because you're still touching the ground.
Okay.
And that radon gas is coming from the ground and it's going to find its way in, and it can move to upper levels.
And even if someone has a brand new house,
Mm-hmm.
they have a really fancy basement.
Yeah.
Really well finished.
Yeah.
Can still get through.
Absolutely. So we've done a lot of research, across Canada's survey, to get an understanding of radon levels across the country. And as a part of that, there was a questionnaire to ask for age of home, style of ventilation system, et cetera. Because it would be easier for us if we could say, if you have this age of home or you live in this area, you don't have to worry about it. But there was no correlation. So age, size, style, you still have to test.
Wow. I'm thinking about people having conversations with their neighbors about this. Mm-hmm. And we talked about that before, about like one person finds out about radon and then you're telling your neighbor, which I think is probably a good thing for public awareness, right? Like, let's get the conversation going with your neighbor. Mm-hmm. But just because your neighbor tested and there was low levels doesn't mean you're safe.
No,
so
not at all.
The answer is always testing, right?
Yeah, absolutely. And that's not just us saying it because we think, you should do it. It's evidence-based. There's a neighborhood in the Ottawa area that we did a lot of research in, and literally you could go down the road and it would be high, low, high, low.
Wow.
So because the first factor is the amount of uranium in the ground, which then breaks down and creates that gas that moves into our homes. But there's a number of other factors that influence the amount of radon that's in our home, how we live, how many doors and windows we have open, the ventilation system we have, et cetera. So really, you have to test to know your number.
Okay. That's great to know. And let's get that conversation going with your neighbor.
Yeah, absolutely. I get calls from people now. It's interesting. I read about radon on my neighborhood Facebook page. And can you tell me about it? Yeah.
Yes, that's awesome.
The power of word of mouth.
Absolutely.
And social media. Yeah.
Yeah, that's so cool.
Yeah.
I know when we were talking earlier, I was just thinking about the risk. I know some people are parents who are listening. So they're thinking about their kids. I was thinking about my beloved dog because he spends more time at home than I do, right? So I'm thinking like, okay, does my dog have an elevated risk? So pets, kids, do we need to be more worried about them?
Yeah, so the risks from radon exposure is cumulative, right? So there's no research that says kids are more at risk in the moment, but their risk long term will be higher if they're exposed to high levels at a young age, because that carries with them for the rest of their life. So if you can reduce that risk at an earlier time, then you're reducing that long-term, later in life risk of lung cancer for children. For pets, there's no research that shows that they can get radon-induced lung cancer, but I have gotten calls from people who truly believe their dog or cat has died of lung cancer, and they found out they had high levels in their home, and they believe, and their lungs can, they're breathing the same air we're breathing. So while there's no evidence, it's possibly a risk. Yeah.
Okay, good to know. Should we talk about testing? Should we get into it?
Yeah.
Do you want us?
We should. Yeah.
Do you want to just like walk us through what testing looks like?
Yeah. So I want to emphasize how easy it is, because we're talking about a pretty serious health risk, right? And that can be worrisome to people. But doing something about it is not hard. So from a testing perspective, you have two options. You can buy a do-it-yourself test kit, or you can hire a certified measurement professional. And the key thing to do is to test long-term. You want to test for a minimum of 3 months. And the reason for that is radon levels can vary quite a bit over time. And so excuse me, our radon guideline level is an annual average. So if you do a long-term test, you're capturing that variation, and then you can estimate the long-term value in your home. So you want to do 3-month test, ideally fall, winter timeframe. And the hardest part of doing the test is remembering at the end of the 3-month period where you place the detector. Oh, and I brought one, but can I grab it out of my bag?
Sure, grab it. Let's take a look. It must be very small if you're digging for it.
My apologies.
Like that's something that could get lost in the house.
Yeah. Well,
that's why you're saying you can forget about it. That's how small it is. Okay.
Yeah, it's a small disc device, and like a small black, and they can be in different shapes and stuff, but it's typically something like this, and you're going to place it on a table in the lowest lived-in level of your home, where you spend at least 4 hours a day, so not in the unfinished part of your basement.
Okay, like in your family room kind of thing.
Yeah.
Your kitchen, somewhere where you are often.
Or in your basement if you use it, or you have plans to renovate and maybe make a bedroom or a playroom down there. But the hardest part is remembering at the end of 3 months where you placed it, where you put the envelope to send it back to the laboratory, so that you can send it back and get your results.
Okay. Yeah. So you put it in the mail. You leave it out for a few months.
Yep.
And this does not look like a very fancy test. This is not what I would.
Yeah. I can explain how it works.
Low tech. Yeah. Why don't you explain a little bit? The technology, because it doesn't look very technological.
No, it's true. And there are different detectors. This is the one that we'd recommend because it's certified. But what's inside of this is a small piece of plastic, similar to the plastic that you see in eyeglasses.
Okay.
And what happens is there's actually little holes, and the air flows inside this little canister, and the radon gas gets in there, and it releases that energy in those bursts, radioactive bursts that I talked about that cause the damage to your lungs. In this device, it causes damage to the piece of plastic. So it creates what we call tracks or divots in the plastic. And when you send this back to the lab, what the lab looks at is that piece of plastic and looks at the depth and the number of those tracks caused by the radon gas to determine the radon level in it.
Cool. So this isn't like, a situation where you can just look at it right away yourself and say, ding,
ding, no,
ding, no, have a high level of radon. No.
Yeah. So these are you would spend about $30 to $50 for a test kit. There are digital monitors that people would be more familiar with. Looks a little bit like a carbon monoxide detector.
Okay.
So there are digital radon monitors on the market. They're not certified, but there has been some research done. So certainly you can visit canada.ca/radon and
Okay.
or contact us, and we can point you to the list of devices that have been evaluated at a minimum, because I know some people like that, but they're much more expensive. So Health Canada wants to ensure accessibility for all Canadians. So we recommend these what we would call passive tests, one-time use
Passive
tests. But they're certified. The laboratories that they go to are certified, so you can trust the results that you get from them.
Okay. So you leave it out for a few months, put it in the mail, goes to the lab does its testing, and then they mail you back like a report. They just let you know.
And they tell you what your number is, and they tell you if you're above or below the Canadian guideline.
Okay.
And then if you're above the Canadian guideline, they give you some information about how to reduce it.
Okay, cool.
And they point you to us usually.
Oh, awesome.
To get more information.
So the key thing here is that it's accessible.
Yes.
It's not too expensive, and you want to put a reminder maybe in your calendar so you don't forget about it.
Yep. To send it back to the lab. Absolutely.
Don't forget about it sitting out.
Yeah.
Okay.
And you can, I will say, I talked about leaving it on a table, but you could also hang it on a wall.
Okay.
I've suggested to people, like, hang it by a light switch that you use often, so you remember, I'm testing for radon.
Yeah.
And it's a conversation piece maybe when people come in.
Love that. It doesn't become also just like another fixture in your home that you're going to just blend into the decor, right?
Right. Or dust it away by accident.
Yeah, exactly. That's awesome. When I was Googling about testing before we chatted, it definitely seemed like there were lots of options out there, or a few at least. And you were saying there's some that are certified, some are not.
Yeah.
And so really the key here, though, is that you want to get a good one. So you want to go to the website and find out the ones that we recommend.
Yeah, so you go to canada.ca/radon, or we've worked with a network of stakeholders in Canada to make a list of service providers accessible. So you could also go to takeactiononradon.ca.
Okay.
But if you go to canada.ca/radon and you look up how to test, it'll connect you right to Take Action. So, yep.
While you're talking, I was just thinking about renters. And so what does testing look like if you don't own your home, you rent an apartment? Like, should you test yourself, or is this something you want to talk to your landlord about? Do you have any guidance about that?
Yeah, no, good question. And so, first of all, the guideline in general, our Canadian guideline for radon in indoor air, is a guideline. It's not enforceable. So there's no legal requirements for landlords to test. But what I would say to a renter, and we do get calls for sure, would be to talk to your landlord, ask them if they've tested the building already, ask them if they're willing to test, and if not, you can test and bring the results back to them. And, there's some landlords who, we get calls from landlords who want to ensure that the property that they're renting out is healthy, and they will test themselves and mitigate. But if not, there are methods that and processes that you can go through to raise concerns if you feel like the environment that you're living in isn't healthy because of your radon test results. We do have some information, again, at canada.ca/radon about renters and landlords and their options and responsibilities related to radon.
Okay, awesome.
Yeah.
Sounds like, once again, it's a conversation.
Yeah.
Right? And some people know about radon, some people don't. So having a conversation with your landlord is probably a pretty good place to start, right?
Absolutely.
Point them to the website.
Yeah.
Also.
Yes. To understand what their responsibilities are and what the risks are and how easy it is for them to test and to reduce it, because we haven't talked about that yet, right? Mitigating.
Yes. Mitigation, super important. We're going to dig into that in a moment. But first, I wanted to talk to you a little bit about motivation, and specifically what motivates you in your work.
Well, sadly, the biggest motivating factor is either having been diagnosed with lung cancer or having a family member who's gone through cancer, lung cancer in general. So being more concerned or aware. And I do get more calls than I would like from people who have lung cancer who've never smoked or quit smoking a long time ago. Because, of course, smoking is a significant risk, and there's a relationship between radon exposure and smoking together that increases the risk of lung cancer.
Right.
And they always say, I wish I had known. I wish I had tested. So the health risk is a big motivator. The other one, interestingly, is just being conscious of the environment and the impacts of climate change, and wanting and understanding how that it also impacts our home environment and the health of our home, and wanting to ensure that we live in a healthy home, because we are spending a lot more time indoors, because we
Right.
do have homes that are more sealed up, and so air quality is a concern, and then radon also is a concern. So they're more likely to hear the messages about the risk, and understand the importance of testing from a prevention perspective, and to take that action. And then for me, I unfortunately my aunt passed away of lung cancer, and it's a horrible disease. And so if you can prevent that risk by testing and reducing your risk to radon gas, I just think it's really important.
Absolutely. I'm sorry to hear that. And I think a lot of us have members of our family that have been touched by lung cancer. And like you said earlier, you want to test before you have to get into that situation, right?
Absolutely.
So it definitely makes you more aware and thinking of your home holistically,
Yes.
as in healthy place to be.
Yep.
Right? Especially since we're all spending more time there, generally, I would say.
Mhm.
Thinking about it holistically, how am I going to have the healthiest home? That's a positive way to think about it, I think.
Absolutely. Yeah. And there's so many choices that we make in life to improve our health or ensure our long-term health, like as you start thinking about where I'm going to be in 10 years and 20 years.
Right.
And this is just one of those things from that perspective. And the other thing is there's lots of things we do to make sure we keep our home safe and us safe in our home. Like I mentioned earlier, the smoke detector, carbon monoxide. Radon is just another thing we need to be aware of and we need to take care of in our home.
Put it on the list.
Yeah, put it on the list.
Okay, let's talk about taking care of it.
Yeah.
How do we mitigate? Is this an expensive solution if we find high radon?
Yep.
Is it complicated? You tell us.
Yeah. So as a standard radon mitigation system, which is referred to as active soil depressurization system, which sounds complicated.
It does.
Yeah, but it's actually,
it sounds kind of expensive.
Yeah. No,
but it's
and
not.
so it's not. No, it's not. It's not inexpensive.
Okay.
Typically, and this again is based on data that we have for radon mitigation systems that have been installed across Canada. What we see is somewhere in the range of $2,000 to $4,000. So not inexpensive. It falls within the range of what we tend to pay these days, unfortunately, for taking home maintenance type stuff.
Right.
Less expensive than replacing a furnace or an air conditioner, and it reduces our risk of lung cancer. But how the system works, because I said it's active soil depressurization, I often just refer to it as a radon reduction system. It's a small 4-inch PVC pipe that's put through the foundation floor in your home, and it's piped outside, either at ground level or at roof line, and there's a small fan attached. And what that fan does is draw the soil gas and the radon gas from under our home and pushes it outside where it gets diluted before it gets into the house. So these systems can be installed in less than a day by a certified professional and will reduce the radon levels by 80 to 90%.
Wow.
Very effective, doesn't take too much time to install it, and it's reducing it and reducing your risk of lung cancer.
And is it reducing the risk of radon like right away as soon as you
Immediately.
install it?
Yeah, that's
immediate results.
That's the really cool thing. If you were to Google, there's videos out there, but immediately you turn that system on, and within an hour you see you have a monitor that's tracking, like real-time monitor that a certified professional would have. It's like a high-end device, measurement device, and you see those levels drop. And a house that's like 2,000 or 3,000, which would be a very high level, drops to, below 100.
Okay, so it works right away.
Yeah, very effective.
Okay, you said certified professional a couple of times.
Yes.
Does that mean I should not personally install my own pipe with a fan?
So, well, first of all, and it's true, I haven't mentioned it, but there is, so in Canada, what we recognize as the Canadian National Radon Proficiency Program, or CNRPP. And if you look that up, there's certified measurement professionals, certified mitigation professionals, and laboratories. And that would be our guidance. But certainly we get calls from people who maybe can't afford to hire a certified professional, but they have family members who are handy, who are in the renovations or trades industry or HVAC area. And we do have guidance that spells out technically how these types of systems can be installed, and we would point them to that guidance. So ideally, you're hiring a certified mitigation professional, but if you're in the industry and you know what you're doing and you use the technical guidance that we have, you can install a system yourself as well.
Okay, awesome. So then I just have one question about it going out into the air again. So the pipe comes up, it's going out like probably into your backyard or the side of your house probably, right? And so then how fast does it dissipate? Like, am I creating then another risk area outside?
Yeah, for your
on my
pets or your
patio?
kids or we get that. We've gotten lots of questions about that. And the answer is it gets diluted or dissipates very quickly within about a meter of the home. And again, we've done research around that. And so, and the roof line level, it gets diluted very quickly. It sort of flows up. But at the ground level, we've done research in homes across Canada to determine how quickly it can dissipate, because we want to make sure we're giving good guidance on where you can put the system, like the output of the system. And it gets diluted very quickly, so it's not a concern.
Okay. Awesome. So before we close, if you had to say one thing, I don't want to put you on the spot, but I'm putting you on the spot.
Oh, that's
okay. You had to say one thing to someone who hasn't tested yet. They live in a home in Canada. What's your best advice to people?
So I would say ultimately it's your choice. We all have our personal reasons for making risk and health-related risk decisions. But I would come back to that message I said earlier about accidental deaths. And it truly, exposure to radon is equivalent to all accidental deaths. That's significant. 3,000 Canadians a year, 8 people a day die from radon-induced lung cancer. And so if you're wearing a seatbelt in your car, if you're putting a life jacket on yourself or your kids when you're paddleboarding or you're out on a boat, if you are changing the batteries in your smoke detector, you need to test and reduce your exposure to radon.
I'm going to get you to plug the website one more time.
Okay.
One more.
Yeah, canada.ca/radon. And there our phone number's there. You can call me personally if you want to have a chat.
I can call you personally and ask you questions?
Absolutely.
I feel like a lot of people might start calling you, Kelley.
It's a total,
after this conversation.
Yeah, we have our numbers and our contact information there. And I'm sure if you Google me in Health Canada, you'd find me, and I'd be happy to have a conversation with you about radon.
Wow. That is a great offer.
It's my job.
Amazing. Well, thank you, Kelley. Thank you for joining. I mean, it's obvious you've been doing this for a very long time. And
not too long. No. I couldn't help it.
Long enough. Long enough that you're very passionate about it. And
absolutely.
You've had a lot of personal conversations with people who have, not tested yet and you're trying to get motivated. And then people who have unfortunately have been impacted by the risk of radon, right? And have had a health problem. So that definitely comes through, I think, in your passion. So thank you. And thank you for giving this practical information that I think people in Canada need.
You're very welcome. Thanks for inviting me here. I've really enjoyed the discussion.
Joining us now is Madeline Poplet. She's the host of our Behind the Science segment. Welcome, Maddie.
Thanks, Megan. I'm excited to be here. You had a great chat with Kelley. She is the right person for this kind of conversation about radon because it is a little scary, but she's very reassuring in her delivery, which I appreciate.
You got it. I totally agree. It was a bit of a journey. Started a little bit scary, thinking about the threat, the risk of radon in my own home. But she is totally reassuring because she gives great practical information about testing and mitigation. And I think that's information that we can all use.
For sure.
So I know you're going to dig in a little bit more about the science with Kelley. Do you want to tell us a little bit about what you're going to talk about?
Yes. So Kelley and I are going to talk about the linkages between radon and climate change. So a bit of a big topic, but it's going to be super interesting to learn about the things that we're doing in our home in regards to climate change and how that impacts radon in the home too. So I won't spoil too much. I'll let her explain it, but it's going to be a great conversation.
Very cool. Can't wait to listen in.
Thanks.
Thanks for tuning into Healthy Canadians. If you're watching on YouTube, don't forget to click the like button and subscribe to stay up to date on future episodes. Find us wherever you get your podcasts and leave us a review if you like what you heard. For more information on health topics that matter to you, Visit canada.ca/health. I'm your host, Megan Beahen.